now I'm going to be doing a PA and lateral chest. So I'm going to have my patient come and stand and put your chest against the board, so you're going to be facing it. I'm going to go ahead and put my shields before I forget. I'm going to have all women will fit on a 14 by 17 lengthwise. Most men require a 14 by 17 crosswise. And for the purpose of lab, you're probably going to be doing all of your PA chest crosswise. So I'm going to go ahead and get my cassette lined up. Now I'm going to align and detent. For this one, we do it at 72 inches. So I'm looking for my 72-inch detent. If you have a particularly short patient and your tube can't go down because the table's in the way, you can always put your patient on a stool. All right, so I know about where I want. So I'm going to center at T7. The way I find that is I put my pinky on the vertebral prominence, or C7. It's kind of that bump on the back of your neck. And the end of my thumb is about T7. So I pretty much centered there almost. I'm going to move down just a little bit. And then I'm going to make sure that my patient is also in the center of the field. Now I'm going to align my bucky. And I'm just using the laser light to align here. I'm going to place my marker. And then once I've got it centered, now one of the last things I'll have my patient do is you're going to roll your shoulders forward. Very good. Some people may have you put their hands on their hips like this. It is a little bit easier to hold that way. You make sure just that their chin is up and her chin is already up. And then I'm just going to collimate to the skin line. I'm going to move you slightly towards me. There we go. I can also feel her mid-sagittal plane just by feeling her spine and know that she's in the middle. You're going to have about 1 inch to 1.5 inches of light above the shoulders if you're centered at T7. All right, I have my shield. So for all chest x-rays, you want to do it on second inspiration. So I tell my patient, take a deep breath in, blow it all the way out. Now one more deep breath in and hold it, expose. Okay, you can breathe. So my marker is PA, so that when they view it on the computer screen, it's going to be AP because we're going to view this as an AP. Now I'm going to do the lateral. So go ahead and turn away from me towards your right. Good. Now I'm going to get a new 14 by 17, and lateral is going to be lengthwise. So I'm going to change the orientation of my cassette. I'm going to make sure that I'm collimated to my cassette because now I changed my orientation. And your posterior lungs they're longer than your anterior lungs. So on your lateral, you will usually go down maybe 1 inch from where you were on the PA. To make sure that I don't clip these posterior lungs. Another thing that happens is the beam is diverging, and when you're standing sideways, it's a pretty big distance from where the beam enters to where the beam exits your body. And so in that time period, the beam is going to diverge. So you do this kind of weird thing where you're actually going to put the right shoulder slightly more towards the anterior than the left shoulder. And I'll have you come right over here. So this is when she looks like she's in a true lateral. I can only see light on this shoulder and I can't see it on this shoulder. So what's going to happen is this shoulder is going to get projected farther back than this one. So what I do is I just turn my patient just a little bit until I see light over here on this shoulder. That little tweak is going to make your costophrenic angles superimposed. So now I'm going to have you raise your arms up as high as you can. Very good. A lot of times there'll be a bar that you can have the patient hold on to. You want them to hold as high as possible. You don't want them in a 90-degree angle because then the soft tissue of the upper arm can overlie the apices of the chest or the lungs. I'm going to bring you back a little. Then I make sure that I'm centered on the mid-coronal plane. And when you have a female, you kind of have to mentally delete breast tissue because you need to be centered to the mid-coronal plane of the thorax, and the breast tissue can be kind of deceiving. So I kind of look here, and this is the center of the thorax, and so I make sure it's there. I'm still centered at T7. All right. Same thing, I want you to take a big, deep breath in, blow it all the way out. Another big, big, deep breath in, and hold it. Expose. You can go ahead and breathe. All right, so now we're doing a lateral soft tissue neck. I have a 10 by 12 lengthwise in the bucky. I'm going to pull this out and collimate to that. So for this one, I would normally have them remove all jewelry and anything removable from their mouth. So any dentures, bridges, retainers, anything like that. So I have the top of the light field above the ear, and then I want to center to the midpoint between the mid-coronal plane and the chin. So I'm going to move her back just a little bit. This is done at 40 inches. We want to make sure that we include the entire pharynx and larynx. So all the way from the nasal passages down past the epiglottis. You will also center at the laryngeal prominence. So if you're centered at the laryngeal prominence, which is the Adam's apple, you should have light right above the ear, and you want to have light to at least the middle of the nose. So we can collimate a little bit front to back. We want to make sure we have till at least the spine, because everything we're looking at is anterior to the spine. So if we know we have the spine on there, then we definitely know we got all the soft tissue of the neck. All right, so I'm just going to adjust my bucky for the little bit of adjustments that I made. I have my marker here, definitely out of the anatomy. Here's the shield. All right, and hold your breath. Don't move, don't breathe. Expose. So now we're going to be doing a decubitus AP chest. This is usually to rule out pleural effusion. And so based on the order, it will tell you right-sided pleural effusion or left-sided pleural effusion. The side that the pleural effusion is on is going to be the side that you put down or on the table. So the patient's going to be lying recumbent on their side, and we're going to be taking an AP view with a horizontal beam. So we're going to have the patient lie down. The patient needs to be lying in this position for a minimum of 5 minutes to let the air and fluid levels settle. So I'm going to feel for the inferior border of her scapula, which I know to be T7, and that's where I'm going to put the center of my film. So inferior border of the scapula at T7, and I've got my film. I want to make sure that I'm going to have you go ahead and scoot back until you feel the film. I don't want you to lean back and put your weight on it, but I do want all parts of your back touching it. So you want to make sure that your patient knows not to lean on this. This is a moving object, but they do need to be flush against it. So the way that we know that there's no rotation is if both sides of their shoulders are touching. So basically you can slide your hands behind it and just make sure that they're both touching. Just a little bit. On my left marker, you're going to mark the side up. So this is Julie's left, so I'm going to put my left marker. And it fell, of course. Okay. I'm going to give her a shield before I forget. And now I'm going to do the same thing that I did with the cross table hip. So I'm going to make sure that I'm very far away from my patient when I'm manipulating my tube. I'm going to be moving my table all the way that way. And I'm going to get my tube as far this way as I can. We're going to try to get as close to 72 inches as possible, which is really difficult. And horizontal beam. And now, since I know that my cassette is at T7, I am going to center my beam to my cassette. I'm also going to look for Julie's midline, which sometimes it's a little hard to see where her body ends and this sponge begins. You have to make sure that you have this pad or decubitus sponge underneath. Otherwise, the bottom of the right costophrenic angle will be clipped and won't show up on the cassette. So I look for midline. Another thing I can have her do is have my patient point to their breastbone, and that will tell me the center of their body. So that's where her mid-sagittal plane is. Good, you can go ahead and put your arm back up. Very good. Now I just make sure that I'm collimated to the size of my cassette. She's been here for 5 minutes. I'm going to ask you to take a deep breath in, blow it all the way out. One more big deep breath in, and hold it. Expose. You can breathe. So you want to make sure that your patient is as far that way as they can get, your tube is as far this way as we can get, and it's still probably not going to be quite to 72, but as close to 72 inches as possible.